Good day, dear colleagues, dear jury members, dear guests. My name is Ruslan Galiakhmetov. I'm the head of International Relations Department of the city of Kazan. Kazan is a dynamic and rapidly developing city. Today, I would like to present an initiative which was developed together with many stakeholders. The initiative is titled Rehabilitation of the City Park Chaikovoye Lake in Kazan. The chaika means seagull in English, bird that has been living on the lake for decades, building nests and raising offspring. Due to COVID-19 pandemic, the year 2020 was very challenging for all countries and cities, and Kazan was no exception. A lot of work was done in our city to support people. It was especially difficult for doctors who worked around the clock, took care of patients, and saved lives. In such critical situation, a person tries to look for quick, high quality and rational solutions. So the idea arose to create a park near the newly built emergency hospital, which helped to tackle two main challenges: the need to create a rehabilitation zone for patients, doctors and residents, and the need to preserve an ecosystem of the lake. Kazan is committed to the principles of international agreements, including the Sustainable Development Goals, the New Urban Agenda, the Paris Agreement, and the Sendai Framework. The initiative is aimed at preserving the lake as a water resource, creating a sustainable infrastructure accessible to all segments of population regardless of gender, age, and social group. The park located next to the hospital helps patients to recover faster and doctors to rest and recuperate. Moreover, local residents from nearby houses have an open, safe, environmentally friendly public space for rest and recreation. Within the spirit of SDG 17, Kazan is ready to share its experience and best practices with colleagues from other cities. Participation in the Guangzhou Award is for sure one of the effective tools for spreading the best urban practices. The aim of the initiative was to create a unique, multifunctional public space necessary for rehabilitation of patients, psycho-emotional unloading of doctors, and recreation of residents. During the construction of the park, large-scale eco-rehabilitation of the lake was carried out. Thanks to the initiative, significant social effect was achieved. Every day, more than 200 disabled patients of the hospital have the opportunity to spend time outdoors at the 7 functional zones in the park. This allows them to discharge faster. Medical staff received an accessible recreation area for rest after heavy shifts, training, and out to relax, which according to the studies among the medical staff improves their mental and physical condition by almost 19% and 35% respectively. Residents of the district have a comfortable space within a walking distance. The Directorate of Parks and Squares of Kazan carries out high-quality operation and maintenance of the park. It is also responsible for ensuring the park with cultural, sports, educational, and entertainment events for hospital patients and local residents. This will help to maintain the activity and attractiveness of the park. First, significant work was carried out on the eco-rehabilitation and formation of healthy ecosystem of the lake. More than 4,000 tons of garbage was lifted from the bottom and the coastline. Silt bottom sediments were cleaned and construction debris was lifted from the bottom of the lake. We planted macrophytes, aquatic plants that allow the lake to self-clean and return to a more natural appearance. Previously, many attempts were taken to clean the lake, but the soil, poor due to anthropogenic impact, did not allow the trees to take root. During the initiative, a lot of fertile land was important. Besides, we partially used the silt from the bottom of the lake as a fertilizer. It made possible to plant a large number of unique trees and shrubs. The territory development concept was created in close cooperation with the representatives of the healthcare industry, expert and chief specialists in the field of rehabilitation, employees and patients of the hospital, representatives of Kazan State Medical Academy. At various stages, experts, environmentalists, architects, activists, and community leaders, volunteers, entrepreneurs, and local residents were involved in the implementation of the initiative. The property installed in the park, Chaikovoye Lake, was transferred to municipal property of the city of Kazan. 7 zones have appeared on the territory of park, where each represents a certain type of therapy. There is a landscape therapy zone in the park where everyone can enjoy picturesque scenery, the lake sitting on the benches. The social therapy zone involves holding various events, sessions in an outdoor cinema. Samatherapy, sand treatment, drawing classes, various master classes are held in the art space area. In Aroma Oasis area, rehabilitation is practiced with medicinal tonic herbs, including treatment with ionized air enriched with coniferous trees. It is possible to grow garden plants in an area of established stationary greenhouse. Two-level platforms with plants are planted outdoors for the possibility of implementing individual rehabilitation programs for patients in wheelchairs. A whole range of rehabilitation equipment, ramps, two-level handrails have been installed for people with disabilities and limited mobility. Since the start of the initiative, more than 6,500 patients of the hospital with limited motor capabilities, in particular those who have suffered injuries and diseases in the musculoskeletal system, nervous system, internal organs, received an individual rehabilitation program in the Health and Wellness Park. It made possible to improve their condition according to clinical and instrumental indicators. However, implementing the initiative, we encountered several difficulties. First, the small Chaikovoye Lake and the large Chaikovoye Lake are the nesting settlement of many species of birds, including gulls, terns, ducks, and others. It was very important to carry out all kinds of work without disturbing their nests and scaring them away. Environmentalists were involved in the implementation of the initiative. They closely monitored and regulated the process. Special areas were created for the observation and feeding of birds. Secondly, at the initiative development stage, we faced with difficulties involving local residents. We managed to achieve public attention to the initiative by distributing information on communities in social networks, electronic and printed news sources, official website of the city, by posting information leaflets. Moreover, a huge number of structures, both public and private, were involved in the implementation of the initiative. Due to the bureaucratic obstacles, it was difficult to coordinate the work of all of them. However, as a solution, we created an initiative multifunctional team, which included representatives of each structure. They kept in touch with each other throughout the entire process. We're definitely going to scale, as the second stage of the project is aimed at the rehabilitation of another lake located next to the hospital, large Chaikovoye Lake. By an online citywide vote, it was decided to carry out rehabilitation work in 2024 on the second lake, which occupies 86,000 square meters. This will provide residents of an even large part of the district and the city with an affordable, free, and safe place to spend time. Large and small lakes will be connected through pedestrian path. Part of the lake will have limited public access and will serve as a bird sanctuary. On the territory of our country, the creation of a park near the hospital, combining recreational and therapeutic functions, open to the public and aimed at the rehabilitation, is a unique initiative of complexity and cooperation of authorities of various levels and the population. We believe that a replication of the practice of landscaping green area near health facilities is possible in other cities. The experience of involving all stakeholders in the implementation of the initiative, including experts and local residents, has proved to be effective and successful, and we are open to sharing our experience with colleagues from all over the world. Thank you very much for your attention.